Okay, so the second part of the workshop, what we're going to do once again, we're going to talk about how can you increase your immune system and how can you decrease inflammation through products that you use. Okay, so we need to clear a lot of things up, what I find working with patients all day long. Where do you get your knowledge from? Unfortunately, most doctors out there don't have any knowledge based upon nutrition, okay? And then what happens is you read the magazine articles, no different than drug companies, telling you what you need. And then before you know it, nowadays I'll have people coming in with nutrition lists just as long as their medication lists. Years ago, it used to be medication list, 2 pages long, and I would ask a patient, well, what nutritional products are you using? And it'd be like 2. Now you're coming in with all of these things, and as proactive as that, it makes me feel happy that you're proactive, but as proactive as you're being, it makes me feel kind of upset that you're not being guided, because a majority of what's on your list is useless for you specifically. We cater our nutritional protocols to the individual. Today, once again, will be a generalization, but when we meet one-on-one, we really get down to the dotted I. So a lot of times you'll also rely on going to places like the vitamin store down the street, and you'll have the 18-year-old with basic knowledge telling you what their manager wants them to push that day or that week or that month. And that's true. That's not a conspiracy theory. That's just how the world works, unfortunately. So today what I'm going to do is I'm going to guide you on what I call the bare minimum. The bare minimum of what I feel every human being on this planet should be using to be as healthy on the inside, to increase your immune system and decrease inflammation proactively at home. Okay? So, with that being said, there's other products that we may need to use with you, and this is where one-on-one consultations come in, but let's talk about the basics, okay? So first things first, let's talk about how do you increase your immune system. Let's talk about this column. We're going to do this in column form. Increasing your immune system. How do you do that? First things first, vitamin D. How many people in this room are using vitamin D?
Vitamin D3, is that
Correct.
what it-
Yes.
Mm-hmm.
Okay. So vitamin D is great. However, what I want to explain to you is that how many people are using a liquid form of vitamin D? All capsule form.
Capsule.
Okay. Liquids for vitamin D are the most successful. And we have a sublingual vitamin D that I use with patients where it goes dropper underneath the tongue for quick absorption into your bloodstream. But vitamin D is very important. Vitamin D is what they call an immune modulator. And what it does is it helps balance out your immune system. I could do a whole workshop on vitamin D, so we're going to keep this nice and simple. So if you're using vitamin D, I commend you. You want the best form possible for absorption purposes, liquid underneath the tongue, but this balances out your immune system. What we use to boost the immune system is called glutathione. How many people, by show of hands, have heard of glutathione? I knew you would. But glutathione is the most powerful antioxidant found in Mother Nature. An antioxidant is something that builds your immune system. What are common antioxidants that you've heard of your whole lives, I guarantee you, are things like vitamin C and vitamin E, and those all have their purposes and they're all great. But what I'm trying to do is come up with a bare minimum of things you could do at home to boost your immune system out the wazoo without having to take 20 million things, okay? So vitamin D will balance out your immune system. Glutathione boosts the immune system. I use a cream form of glutathione with patients where you rub it over certain parts of your body depending on what's going on with you, and it gets absorbed into the fat tissue and then into the bloodstream for quick absorption. So vitamin D, glutathione, these will boost your immune system. But the most fun part of this workshop that I love to talk about is stuff you may not have heard about. Where does 70 to 80% of your immune system come from? Anybody want to take a guess? What part of your body, 70 to 80% of your immune system?
Stomach?
Your gut. Very good. We're going to call it your gut, but your digestive tract, your gut. So in reality, this is extremely important right now. This is a very important concept that technically, if you understand that fact, that is a fact, that is not an opinion. If 70% to 80% of your immune system comes from your gut, you're using this to balance your immune system, you're using this to boost your immune system, but you have never done a single thing to help heal your intestinal tract. Think about it. You need to.
probiotics.
Okay, well, we're gonna talk about that,
Yeah.
okay? So there's two things that we wanna use to help heal the digestive tract, okay? One of them is absolutely a probiotic.
Yeah.
Probiotics are the good intestinal bacteria,
Yeah.
okay? But, food for thought, who in this room is using a probiotic? Excellent.
Every day.
Okay, excellent.
And
It's ve-
Acidophilus.
It's very important, okay? Okay? So probiotics. However, putting the good bacteria in your digestive tract, think back, I remember when I was a child and I would go to a pediatrician when doctors did a lot more back then. Remember, they would, let's say you had a sore throat, they would do a cotton swab, they would put it in a petri dish, they'd let it grow in their little refrigerator in their office, and then they'd have to call you within a day or two to let you know if you actually had strep throat. Doctors don't really do that anymore. They do a whole lot of guessing now, and they just say, take this, it's probably strep, take this. But going back to that analogy of the petri dish is kind of analogous to what we're talking about with the gut. You could put a great probiotic in your digestive tract, but if you have never done anything to heal the intestinal tissue that it needs to grow on, how well is it really going to work for you? So when I work with patients, we use specific products that we'll discuss one-on-one that works on healing intestinal tissue. And I have a whole regimen of what I do with patients to heal intestinal tissue that we could discuss one-on-one, that you use in conjunction with the probiotics. This part you don't typically need to do forever. We need to do it for a certain period of time depending on an individual. Probiotics you use indefinitely. But you need to heal tissue for the probiotics to grow. They're bacteria. So once again, recapping, vitamin D balances, glutathione boosts. Probiotics, great for the intestinal tract. 70 to 80% of your immune system comes from your intestinal tract, but heal intestinal tissue. So therefore, it could work better. Talking about how do we decrease inflammation when it comes to nutritional products that you can use. Somebody mentioned this before. You can use things like flax. Flaxseed is a great product to use to decrease systemic inflammation. And a lot of times what patients don't realize is you could use this interchangeably with fish oil. Okay? Sometimes patients are on blood thinners and their doctors are very cautious about fish oils, and this is where, once again, this is a generalized workshop. We could always discuss one-on-one if fish oils are right for you. But flaxseed and fish oils will accomplish the same thing of an anti-inflammatory response. Then, there's a supersonic product that I use with patients that we'll discuss one-on-one that deals with the nitric oxide system. And what the nitric oxide system means that this is a product that we use that helps with circulation. Okay? You can't use products like this for certain situations, and that's why I do this one-on-one where we discuss this. But this is a product that is really, really great with what it does. It increases circulation, therefore getting more blood flow to the periphery. Okay, so let's say you're suffering from something like peripheral neuropathy and you're having trouble with the nerves in your feet. This will provide a systemic vasodilation of your blood vessels, delivering more oxygen and nutrients to your tissues. You will heal quicker.
Very
Okay?
good.
So and we're going to talk about that. So this concludes the second part of our workshop, where we spoke about nutritional